And what about eyelid surgery? What does that mean exactly when men go in for the eyelid surgery?
So the eyelid surgery, it's something now that we're noticing, and this is as obviously one of the things that happens as men age. Like women, one of the things that will happen is you'll have saggy or excessive skin in the area
right?
Exactly, and that makes you look older.
Right.
So they will go and you can actually treat the eyelid and rejuvenate it, and actually takes years off your face by treating those. And it's a very simple procedure, especially and you see it most with men are usually trying to deal with the upper eyelids, and their lower eyelids, what they try to deal is with those bags that you see around the eyelids, and that's usually what they're trying to treat.
That's called life and age.
Exactly. Yeah.
So how does the eyelid procedure work? How do you, and someone goes into your office, is it a very quick procedure or?
So usually, like anything, if you're going to have a proper assessment, first we're going to look if you're a candidate for this intervention. We make sure, the number one thing they're going to do is make sure that there's no contraindications. We try to look, make sure that the person does not have dry eyes or there's problems, because if you go and excise skin from your eyes, then you might end up with exposed, the exposed eye and having and giving you problems with your eyelids, especially with the dryness of the eyes. So we go and make sure to examine the patient, make sure that they're not having a problem with their eyebrows as well, because sometimes it's descent in the eyebrows, and then we say no, the problem is not so much that your eyelids are sagging, it's that your eyebrows are sagging. So it's a conjoined assessment that we're doing. We're assessing the entire upper face and making sure. So first thing, we make sure that there's what the anatomy is, making sure there's no contraindications, and then let's say that the patient is okay for the intervention, then we would proceed with the intervention. The intervention for the upper eyelids, when you're doing skin-only interventions, it's a very fast procedure. It can be done in the office. It's probably around an hour procedure.
Okay.
When you're going to go and remove fat and get inside of the orbit or behind or close to the eye, then it's probably more preferable to do it under anesthesia where the patient will be more comfortable.